My name is Larry Schaefer. This is my bride, Carol.
From the moment you meet them,
We've been married for 60 years.
it's clear the Schaefers have lived a life of devotion, first to each other.
Carol and I met at college in 1964. There was Sadie Hawkins Day celebration, and she asked me out on a date, and that was the beginning of our relationship.
Their story is also defined by their 2 children, 3 grandsons, and a lifetime of community service.
I'm just grateful that I've been able to continue to serve the Lord in that way.
So it was not easy for the couple to transition from giving help to receiving it.
Hello, Mr. Schaefer.
Good morning.
How are you today?
I'm blessed.
That's good.
Come on in.
Glad to hear that.
It comes in the form of weekly deliveries from Second Harvest Food Bank.
These are breakfast yogurts.
Meals that go beyond filling a need for food.
Chicken thigh, broccoli.
Larry's health depends on them.
On Thursday morning on September 25th, and I said, Carol, call 911. The ambulance came, and I said, my cardiologist is at Advent Health. And I said, well, that's where we're taking you. But I've had a heart condition since 1995. I'm about to get pacemaker defibrillator number 8.
But even with that history, Larry had never heard of what the doctor ordered when he left Advent Health.
All right, day 1, quinoa oatmeal.
That's when he entered the medically tailored meal program.
I feel like this program is going to save a lot of lives in Central Florida.
Meet registered nurse Grayson Holmes.
My role in this program is that I partner with patients and I kind of serve as a coach. That transition to home can be very difficult for patients. So we've learned that if we engage in conversation with patients before they discharge to home, we can learn things that they may need while they're out in the community.
So I think that these meals may be a really good fit for the
Once a
patient.
referral is sent to Second Harvest, a plan is put into motion based on a patient's needs.
Obesity, diabetes, hypertension, congestive heart failure, and on.
Maureen Hawkins is the Director of Health and Hunger Strategies at Second Harvest Food Bank.
So we do a nutrition assessment, and we provide that nutrition information in that box after their assessment to make sure that we're treating that patient for the needs that they have.
And I just wanted to call and connect with you guys because I have a patient that I've identified that I think may be a candidate for our Second Harvest pilot here.
The process takes coordination.
We have a very clear referral system, so we don't have anybody waiting. We can get somebody's service usually within the next day.
I explain the whole program and then they say, well, what's the catch? And I said, there's no catch, it's actually free. Their eyes light up, they get very excited, and you can almost see relief in the patient's face that they now know that that's one less thing they have to worry about when they transition to home.
Now we have a full freezer.
The medically tailored meals program is just one example of the partnership Advent Health has built with Second Harvest through the years, from staff volunteering at the food bank to innovating programs focused on making our community feel whole.
We want to make sure that we can keep people at home and feeling their best. So it's something I'm really proud of and excited to continue to work with Advent on and expanding to others.
Looks good.
The results of that work on full display back in the Schaefer's kitchen on delivery days.
And in the first week, I think I lost 3 pounds just because of eating so healthy. I put them back on, so I've been cheating. It's just amazing the ministry that they're providing, and I'm so grateful.